Joia, set the stage for us. What is global health care? I mean, is it just public health on steroids? I mean, what is it? What's the difference?
So when we talk about global health, we really mean, I think, two things. One is really providing medical care, and that's the effector arm that Senator Frist was talking about, which we do largely at Partners in Health. But perhaps more importantly, developing a discipline around how to deliver that care. What is the research that can teach us best practices for healthcare delivery? How do we train healthcare professionals in the U.S. to contribute to this, but also local health professionals?
What we want to do is to say the tools of our trade can't be, what gets used in the tools of our trades can't be decided by your station in life, whether you're poor or rich, or whether you're in Haiti or Harvard. Saying it is easy to do, and then how to actually deliver those services is something I think we can learn in the teaching hospital, certainly, but why should we be doing this? One, the students want to do it. Two, the mission statement says we should. Three, we can do it. Four, it's very satisfying work. Five, we have tools now that we never would have dreamed about just 3 or 4 years ago. That global health should be central to what a major research university should be thinking about. There are other problems in the world. There's violence, there's ecological challenges, the list goes on, but we believe that healthcare and equity is way up on that list.
You wouldn't teach at this point climate change as it affects only the United States. This is a globalized world. You wouldn't even teach business anymore as it affects the United States. Yet we teach medicine today as if it only affects the United States.
Frist was central to using medicine as a means of really lessening, of improving our standing in the world in a good way, in a noble way, but also probably lessening what some of us would call structural violence. So if you look at the impact of PEPFAR, and I know you have looked at it closely, and a number of us have, that was the largest global health, first global health program that linked prevention to care effectively, using all the tools of the trade. It took a lot of struggle, and a lot of us are grateful for those willing to do it. But if you ask me, is that also, and this is something, as I said, Vanessa's thinking about, is that a good investment in building a safer, less dangerous world? I think it surely is. We're going to be doctors and teachers effectively if we can't link all of those three activities together, providing the service, which sometimes requires actually building a hospital, as you've seen, but also training the next generation, and then finally, again, improving the quality of what you're doing through research. And I think that's what we do.